Do you drink Diet Coke? Do you drink maybe more than one a day? Do you chew gum? Do you have coffee and maybe put a little sweetener in there? Well, listen up. The World Health Organization says a common artificial sweetener is a possible cancer risk. Joining us to talk about this, Dr. Jeff Pothof, UW Health's Chief Quality Officer. All right, doctor, this got me to stop and listen. WHO says aspartame is a possible carcinogen. What does that mean?
You know, what this means is that when they look at aspartame and they look at it in large studies where they use, fairly large quantities of this artificial sweetener, they see an association between large quantities of this sweetener and cancer development. So it's true that this sweetener is in a lot of things we drink, whether it's sweetened beverages, particularly, your Diet Cokes, some artificial sweeteners for coffee, gums. I think the take-home message here, though, is that for most of us, not all of us, but most of us who aren't using this at really high levels, and for Diet Coke, it comes out to something like 18 cans of Diet Coke per day. That risk is exceedingly low, and I wouldn't necessarily throw your diet beverages away. But I think the larger message that we've been seeing is, these artificial sweeteners, they were preferred because of all the sugar we could eliminate from our diets by switching to them. But all of these have some risk, whether it's cancer risk, stroke risk, heart attack risk. But it usually takes a pretty high doses that we're not getting by just, routine drinking of some of these beverages or chewing a stick of gum.
The headline got me because you start to look at some of the research. The research on this is all over the place. I mean, in one of the studies I read, they were giving mice like 4 times their body weight in the sweetener, and what do you know? That's not good for you. But really, it's not been conclusive, right? So any idea why the WHO maybe put out this headline?
No, I mean, I think, WHO probably put it out there because they want to be transparent. If there's a potential risk, that they want to make it known. But I think, with a lot of these things, you really have to dig into, like, what does the research say? And I'd say it's still a bit inconclusive. There probably is an association, but no one's drinking 4 times. Well, I shouldn't say this, but most people are not drinking 4 times their body weight in Diet Coke per day. So that risk gets a lot smaller. The headline is captivating, but the real risk is probably much smaller than that.
Let's switch gears here. There's a first ever over-the-counter birth control pill on the way. It's been approved. You don't need a prescription to get what's called the Opill. For people who obviously have the prescription, they're thinking, what's better? Is the Opill not as good because you don't need a doctor's note?
Yeah, no, that's not the case at all. In fact, as much as we are ahead of times in technology and medicine in the United States, this is one where we're a little bit behind times. So Opill, which is a single hormone daily contraceptive, is approved in about 100 other countries. And the thing with Opill is it's pretty effective, 93% effective in preventing pregnancy, but you need to take it the same time every day in about a 3-hour window. What happens if you need a prescription and you're running low, you got to get a hold of your doctor. They have to write the prescription. You have to go get the prescription. It can be hard to maintain that, everyday pill when it's easy to get. Like I can just walk into CVS, Walgreens. It's a little bit easier to do that. Women can be more effective in controlling, whether or not they get pregnant that way. So I think that's the big push here is it creates easier access to this medication for women, but it's just as effective as it's always been. It's been on the market since 1973.
Good information there. I know there's still questions like maybe the price on there, but we'll know soon on that. Dr. Jeff Pothof from UW Health, appreciate your time.
Thank you.